When is the last time you checked in with yourself and asked if you're really taking care of your mental health? Because that is a very important part of living in a pandemic. This morning, we wanted to know what you're doing to boost your mental health right now. Maybe your ideas could help someone else who's watching this morning. You can let us know by texting the number on your screen, 303-871-1491. Our 9Health expert, Dr. Payal Kohli, is joining us. Thank you so much for getting up bright and early with us on this Saturday. We have been hearing about more and more people living with anxiety and depression. What have you been seeing and hearing, and who is this impacting the most?
Good morning, Anusha. So, the effects of the pandemic, the mental health effects have been quite variable. We have seen depression and anxiety, as you said. We've also seen an increased incidence of substance abuse. And of course, not unexpectedly, a significantly higher incidence of the loneliness pandemic getting worse. But researchers have actually coined a new term called coronaphobia to really describe all the mental health effects, the social effects of what has been happening during the pandemic. And there's two main components to this term. The first is an irrational fear of contracting the virus to the point that it's interfering with your daily functioning. For example, you might be afraid to leave your home, or you might be afraid to go to the grocery store, do kind of the activities that we normally would do with our daily living. The second part of this is an irrational fear of those who have contracted coronavirus and recovered, again, for the fear that they might spread it to you. So fear is a big part of coronaphobia, but as I said, it also encompasses other types of behaviors such as anxiety, avoidance, repetitively washing your hands, those types of behaviors. But the nice thing is that we've now learned so much about the virus that we can really combat coronaphobia because we know how it spreads. We know that people who've recovered from it are less likely to bring it to you, at least while they have antibodies, and we know that we have treatments for it. So I think awareness is the first step in terms of really combating coronaphobia.
Yeah, it's interesting. You put a name to it and describe it, and some people can go, oh yeah, that is what I'm doing. What can I do to help myself? Are there physical effects to all of this that people may start noticing?
There are actually physical effects to all of our mental health. So our mind and body are so closely connected that whenever we have anxiety, for example, our body is in a fight or flight response with our stress hormones elevated, in particular cortisol. And what that can do is it can raise your blood pressure. It can cause salt and water retention. It can cause cardiac arrhythmias or abnormal heart rhythms. It can cause, weight gain. It can suppress your immune system. And then, of course, we're not sleeping well, which can also affect our immune system. We might be using more substances, as we talked about. That can be a factor. All of this causes inflammation in the body. It can cause our hair to fall out. So all of these mental health effects are not separated from physical effects. And for some people, actually, the physical effects manifest before they realize or have insight into the fact that they may be having some mental health effects.
It's so interesting. When I first realized that, it helped me recognize sometimes what was going on with my anxiety as well. Real quickly here, for people who are saying, okay, I need some tips. What can I do today that could help me out?
So, the concept here, Anusha, is to really think about our social immune system. So, we have a physical immune system that fights viruses and bacteria, but we also have a social immune system that protects us from mental health problems, and we have to keep that in shape. So part of how to keep that in shape, of course, is to get enough sleep, to exercise regularly, eat a well-balanced diet. But the hard part about doing that during the pandemic has been that social connection piece, reaching out to others, having that human connection, which we really strongly encourage. The other piece of this is to keep your eyes and ears open for yourself and your loved ones, because the key is a normal amount of anxiety is normal, really, during a time like this. But when it starts interfering with our daily functioning, that's when we need help. We need to reach out to our doctors or connect with other resources. So start to, stay attuned to whether others' behaviors may be changing to the point that it's impacting their daily function. Right. I personally like to meditate, so that's what I've been doing a lot more of.
Yeah, no, absolutely. And I think this is fantastic. And I'm so glad that we had a chance to talk about this morning. Thank you so much for your time, Dr. Kohli.